Hello, this is Dr. Eric Bricker, and thank you for watching A Healthcare Z. Today's topic is employer healthcare priorities. So today's video is about the Mercer Employer Survey for the 2023 plan year. So this survey just came out. Mercer does it every year, and they survey several hundred employers, and they put them into three size groups, so under 500 employees, 500 to 5,000 employees, and 5,000 employees plus. And the majority of the employer respondents are 500 employees to 5,000 employees. That's the largest cohort, and then but they got quite a few greater than 5,000 employee companies that respond to this survey as well. And their answers are super interesting. The number one result of this survey is that 70% of the survey respondents say that their strategic priority for the 2023 plan year is for benefit enhancements. Okay, so what is the healthcare priority of employers for 2023? Per the Mercer survey results, it is enhancing benefits. It is not lowering healthcare costs. Now, I will return to that point again at the end. So, why? So, they even have this great little abbreviation for it that I've never seen before. They just call it A&R. And of course, that's attraction and retention of employees, right? Because that is a huge challenge for employers today. So, as many of you know, as of June 2022, the employment rate in America is 3.6%, which is super low. So, during the peak with COVID, it very briefly went up to 15%. And during the great financial crisis of 2007, 2008, 2009, it peaked at 10%. So an unemployment rate of 3.6% is incredibly low. And you've seen for a long time now, well over a year, that employers have been having a hard time attracting and retaining employees. And there are signs all over the place as you drive down the road, even still today, for companies, organizations that are hiring. They're trying to find folks. Okay, so fine. So the world of enhancement of benefits is very large. So that then begs the question, okay, well, how are employers enhancing their healthcare coverage for their employer-sponsored health plan? So, what is one of the biggest complaints that people have? Well, healthcare's too expensive. So what are the employers doing? They're making it more affordable. In fact, arguably, the number one priority of employers in terms of enhancing benefits is just to make their health insurance coverage more affordable, to make it cheaper in terms of the out-of-pocket costs for their plan members, for the employees and their families. Duh! That's not rocket science. So we had this huge shift to consumer-directed, high-deductible health plans from the great financial crisis to today, where literally in 2007 it was only like 2% of employees were on a consumer-directed health plan, to now today it's upwards of 33 to 35% of employees are on a consumer-directed health plan. And now employers are saying, hey, maybe we need to dial it back. So 41 of employers in their response are offering some type of lower deductible plan. In other words, typically there's multiple plan options, but they're offering a plan option at each of these particular companies that has an even lower deductible or even no deductible, where it is copay only. In other words, it is not necessarily an HSA compatible plan, right? Because in order to have an HSA compatible plan, the copays had to go away. And they're saying, look, to make it more affordable for people, let's get rid of the deductible and let's just give out copays. Straightforward, right? Just make it cheaper for people in terms of their out-of-pocket costs. Okay, priority number 2, behavioral health. Of course, we have all heard many times in the news and from many of our personal experiences with our families and friends as well around challenges with depression, anxiety, substance abuse, etc., with mental health. And so employers have in the past and are continuing to address behavioral health in their plan membership. Now, interestingly, the way that they're doing it by far and away is through the existing structure of the EAP. Now, they're calling it, which is the Employee Assistance Program. Now, they are calling it an enhanced EAP, but no, it is not some sort of like brand new category, right? So there's typically like these categories of benefits, right? So obviously there's major medical, there's dental, there's vision, there's group life, there's disability insurance, and typically an EAP was one of the big buckets within that sort of menu of benefits that your typical company would offer. So the majority of employers that are offering some type of enhancement of their behavioral health are doing it through an enhanced EAP, through sort of that existing structure that already exists. Now, interestingly, 62% of the responding employers are adding self-service technology resources. In other words, websites, apps, etc. So, what's interesting here is that both of these, the EAP and the self-service, historically, and then just because self-service through an app has very low marginal cost, right? I mean, you just build the app or the website, and then the marginal cost for each person to use it is essentially zero. So what do EAP and self-service? It's very low cost. And so here, one might argue that employers are addressing behavioral health, but they're not necessarily spending a lot of money on it. Okay, next up. Interestingly, virtual care is the third priority in terms of an enhancement for healthcare or the benefits at an employer. So notice, virtual care, they don't talk about this as a cost-cutting mechanism or as a way to reduce healthcare costs. They look at virtual care as a way to enhance the benefits. Now, when they say virtual care, what they mean is beyond existing what they call telemedicine, which is essentially the virtual urgent care model, right? Where you don't have an appointment, you just either call or you do a video conference, you get some random doctor or nurse practitioner every time, there's no continuity of a relationship, they address your acute care need right there. It's been around for over 10 years. Even in the Mercer survey, they say, look, at the end of the day, everybody's got traditional telemedicine. The point is that virtual care offerings beyond traditional telemedicine. And what's the A number one? It's actually the behavioral health. So it's really just taking a look what can be offered through the quote-unquote enhanced EAP and offering it virtually. And of course, this grew out of the COVID pandemic with so many things being shut down, and they're like, oh, well, you can actually have behavioral health visits so you don't have to travel, etc. And to a certain extent, it worked out very well. So the majority of employers that are offering expanded virtual care offerings are doing that in the form of a virtual behavioral health offering. Now, interestingly, number 2 is virtual primary care. Now, note, if you dive deeper into the Mercer survey, it is not a virtual first plan. In other words, it's not like you have to use a virtual primary care physician before you can access other healthcare services. No. In fact, it says that that's the vast minority of virtual care. It's really just a virtual primary care physician option for people beyond their existing in-person primary care doctor or in-person specialist, etc., like they traditionally have through their existing employee health plan today. So, number 4 point that I want to talk about now is what I said at the beginning, which is, look, all of these things are strategies that are meant to enhance benefits. The healthcare priority for employers for 2023 is to enhance benefits. It's not to lower healthcare costs. What do we talk about all the time on A Healthcare Z? Healthcare costs are too high. What do you see in news stories all the time on the internet and on cable and on all these other potential sources that you watch for news? Healthcare costs, healthcare costs, healthcare costs, healthcare's expensive, healthcare's expensive, healthcare's expensive. Aha! When it comes to the cohort of organizations that pays more for healthcare than anyone else in America, which is employers, right? So employers actually pay more for healthcare in America than the federal government or state governments. It's larger than Medicare, it's larger than Medicaid. So for employers, healthcare costs are not a priority. And that's a real head scratcher, because also in the news, you also hear about a lot of issues related to healthcare that are related to healthcare costs, such as price transparency, right? So now health plans and hospitals, they got to release all their prices and yet. And listen, at the end of the day, employers are not using transparency, price transparency, as a strategic priority within their employee health plans for 2023. Like, they're just not. Likewise, they're not using the PBM, for lack of a better term, controversy now, right? The feds are going after PBMs now. Large states have gone after PBMs now for things like their spread pricing, for things like their questionable rebates, for things like their questionable fees, for potentially increasing the cost of prescription medications. Like, look, like, nowhere here did it say that moving to a transparent PBM was the number one priority for employers in 2023. It's not. No, again, you hear about this in the news, but as far as what employers anonymously say is where they're putting their time and their attention and their money is not in a PBM. So what's my point here? My point for all of this is the market is not wrong. Customers are not wrong. If you think that transparency and PBMs or whatever healthcare cost things should be a priority, guess what? The customers that have the money, i.e. the employers, don't agree. And so the point is that you gotta bend with the trend, especially if you're a digital health company or if you're a broker consultant or if you're talking with folks that work in employer-sponsored benefits at all. Like, if their priority is affordability, behavioral health, and virtual care, and you come in with this huge, like, healthcare cost reduction, transparency, PBM message, just know that that might be of interest to a minority of listeners, but you're going to need to knock on a lot of doors, because that is not the priority for the majority of employer purchasers, as per their survey results. Now, of course, healthcare is huge. The employer-sponsored healthcare is an enormous market, and you can say, well, even if you find like this little niche, it's still large enough for a particular, startup, etc. And that's totally true. I'm not negating that. I'm just saying that it's oftentimes, especially if you're running a business where you need to charge customers and generate revenue, it's often very helpful if you bend with the trend. And the trend is in the direction of enhancement, not cost containment. I'm being a realist here. As much as I would like to say, look, the exploitative relationships in healthcare, the waste that's in healthcare, that needs to be employers' priority for 2023. It's not, okay? So I'm just calling a spade a spade. Now, this brings up the last point that I'm going to talk about today, which is you're starting to hear rumblings about a recession potentially coming in the back half of 2022 or in 2023. Now, we have seen a change in employer healthcare priorities with recessions. So during the Great Financial Crisis is when employers pivoted to HSA and HRA, consumer-directed health plans, where they were focused on cost containment activities because unemployment was up at 10% and not 3%. Likewise, you saw the rise of health maintenance organization for employer-sponsored plans in the early 90s, again, when there was a recession and unemployment went up. So, note that employers are a little fickle. They do make healthcare costs a priority, but they don't make healthcare costs a priority when unemployment is low and the labor market is tight and attraction and retention is what they, as an overall business, need to focus on. So this brings up the sort of the fits and starts when it comes to employers as a force for change in healthcare. Because at the end of the day, employers are not a consistent force for change within the healthcare system. They're not, and they probably are never going to be. Like, until we quote unquote get rid of the business cycle, we're probably not going to get rid of these fluctuations in priorities for employers. And so that has very real ramifications for health insurance carriers, health insurance brokers, benefits consultants, for digital health startups, etc. So this is the lay of the land for 2023. If you want customers that will pay you, it will behoove you to bend with the trend with employers, and that trend is enhancement, not cost containment. And that's the point I want to make today. Thank you for watching A Healthcare Z.